So we're trying to develop a new potential cure for low back pain. So low back pain affects about 80% of the population at some point in their lives, and 40% of cases of low back pain are due to the discs in your spine, which are between the vertebrae in your actual spine, and they degenerate, and that can cause low back pain. So what we're developing is an injectable hydrogel system, which is basically 90% water, which is liquid outside the body, and when you inject it into the actual disc, it gels has similar mechanical properties to the native disc. Now what's really exciting about this hydrogel is we can deliver the patient's own stem cells, so we can take stem cells from the patient's bone marrow, mix them in our hydrogel in the clinic and inject them into the actual disc. And the environment of the disc then tells those cells, and the hydrogel tells the cells to turn into disc-like cells. So they then produce new material which rebuilds the actual disc and regenerates it. We've just got £300,000 from 2 grant sources, and that's allowing us to take it to the next step. So we can now, with collaboration with a group in Amsterdam, allows us to look within a culture system where we can take whole organs, i.e. the whole disc from either goat or human spines, and actually look within a loaded environment, because obviously our backs are loaded, you move around during the day. So within those environments, and see how the stem cells can behave in that environment to see whether we can regenerate a degenerate disc under the environment seen within the human.
Hydrogels are 3D cross-linked polymer networks containing lots of water. This particular hydrogel is based on a material called polynipam, which has got a thermal transition close to body temperature. So we've got something which is a very low viscosity liquid above 37 degrees C, and at 37 degrees C it forms a gel in the body. So one of the things that we're wanting to do within this particular project is to examine the mechanical properties of the gel and also look at some of the chemical properties, and these are things which are essential to find out as we move towards a clinical use.